Hello everyone, welcome to Health for You by UBE Media. My name is Dr. Pranav Kumar. I am an orthopedic surgeon and I mostly do spine surgeries. I've been trained in England for spine surgeries and probably I am the only person in Indore who has been trained by neurosurgeons. Otherwise, normally orthopedicians are trained by the orthopedicians and the neurosurgeons by the neurosurgeons. There are lots of topics where there is lots of confusion as far as spine is concerned. One of those topics is sciatica. The general misconception is the sciatica is a problem of only the nerve. Let me make it very clear, it's not the nerve which is getting the problem. The problem is in the spine most of the times or the hips. By definition, if you talk about sciatica, it's any pain which arises from the back or the hips and travels down the leg is called a sciatica. The general problem with the sciatica, the reason sciatica is very untreatable or people don't treat it properly because they don't understand the basic cause of it. If you understand the basic cause being the back or the hip, then you can treat it. But here you see daily, I daily see patients who are coming with symptoms of back pain with the pain shooting down the leg, and they have been given multiple injections of multivitamins and all those things, and they don't improve because you are not actually treating the cause of it, you are treating the effect of it. So if you treat the effect, it's like treating the fever for say. If you don't treat malaria or typhoid or whatever is causing the fever, you will lose the patient. Similarly with sciatica, if you don't treat the back, you will not be treating the sciatica. So that's the reason it is a dreaded problem. If you talk about sciatica, it's mainly of two types: acute and chronic. Acute is one which is coming within a few days and it will last for a few weeks. Chronic sciatica is the main culprit because it's there for more than at least 3 months. The symptoms are like you have a back pain and then you have pain shooting down your leg, and depending on the nerve, the pain shoots down either on the inside or the outside or the back bit. If you talk about the causes, the most common causes, of course, nerve compression due to the disc. Second is stenosis, which is compression of the nerves because of either the bone or the ligament which is coming and occupying the space which is there for the nerve. You can have osteoarthritis of the joints, which can cause compression on the nerves, and then you have shooting pain down the legs. And you can also have slip of the bone, which will cause the compression of the nerves. And these are the reasons you have. So if you see, it's not the nerve per se which is the problem. It's the problem with the spine which is causing the problems. So if you treat the spine, then you will be able to treat the sciatica. Diagnosis most of the time is examination based, and you need to consult a doctor if you are suffering for a long time and you are in agony. Then you need to consult a spine surgeon who will be examining you, and then most of the times they do improve with conservative management. Conservative management as in self care. You need to change the way you are doing the things. It's most of the times these small things which helps you a lot. It's not the surgery, it's not the medicines, it's the exercises which are the main thing. If you stabilize your spine biomechanics is better. Most of the times that's what helps you a lot. And there are studies published, there are sports trial going on in US, there are other trials going in Europe, which conclusively prove that most of the times you don't need an operation, which is the general belief. But if you need an operation, it's no point delaying the operation because the prognosis or the results will be worsening if you delay it for too long. If you talk about surgeries, there are two kinds of surgeries. It's either stabilization or a decompression. Most of the times it's just a decompression, which is removing of the pressure on the nerves, either the disc or the ligament which is causing the problems. Or sometimes you end up having an operation which involves putting screws and stabilizing the spine because it is moving frontwards or backwards. That's the main thing. So you need to understand that the most important thing about sciatica, it's it's not a disease, it's a symptom. You need to treat the disease to get rid of the symptom. Today I would be talking about degenerative disc disease. So you need to understand what a degenerative disc disease is. If you understand degeneration, you most of us have had knee problems or hip problems or spine problems, but we don't understand that our body degenerates as it ages, and beyond certain age it starts degeneration. I've seen people who are young, who are involved in desk jobs, getting back pain as early as 20 years of age, and that's because of the wear and tear in the back, and it's mainly the disc which is wearing and tearing. So what happens is, you have the disc which gets dehydrated, so the water content of the disc is decreased. So if you look at a disc, any disc is something like this. So any disc is a shape of a disc. So if you have a disc here, there will be a gel here which is been protected by the covering, which is called as annulus. So you have a nucleus pulposus which is in the center, which is basically like a jelly thing, and then you have the annulus fibrosus which is protecting this. So if you talk about the disc, this is how it looks normally. So if you see, there is a space between the two vertebra, and then you have this disc kind of thing which is called the intervertebral disc. And if you see, behind are the nerve roots. So if anything happens to this, the space between the vertebra will decrease, and gradually it will start compressing the nerve roots. So if you see, if you go and see, this is what a completely degenerated disc looks like, and this is what a healthy disc looks like. So if you see, the height is decreased, there is bone formation in the front, there is disc which is coming and pressing on the nerve roots, and the whole shape of the disc is gone for a toss. In between is this stage where you have slight amount of decrease in height, slight amount of pressure, but then it ends up having this. So we need to treat this before we reach this. Talking about symptoms is mainly back pain, and we need to understand that back pain, any spine problem, the pain is of mainly two types. One is the back pain, which is mainly because of the problem with the biomechanics of the spine. If you understand the spine, there are curves in the spine which helps the body to be erect and help us walk. Over a period of time, because of wear and tear, the spine curves and the biomechanics gets altered, and this is the starting point of all the problems, because we don't, and this happens, the reason for this is we are not using our back the way we should be using. There was a study published by Nachmason way back in 1970s where they saw the pressure on the disc when somebody is sitting or somebody is standing. So what they saw is, when a person is lying down, suppose if it is X amount of pressure, it will be 4x when somebody is bending forward and trying to lift a weight. So if you understand, the pressures on the disc is great, and we need to understand that our back has to manage all this pressure. The most important thing which helps the spine is the muscles, and if your muscles of your back are not strong enough, all the pressure will be on your back. The reason this happens is, you have back pain and we don't take care of the back pain, and then the muscles gradually degenerate, and this starts the perpetual cycle of degeneration, ultimately leading to all the problems. Some other problems are like, if there is any injury which has happened and caused damage to the disc. Arthritis can also cause degeneration of the disc and lead to degenerative disc disease. Osteoporosis, because of the weakness of the bones, the vertebra which is around the disc, will also cause the problems later on. Obesity, because you are putting so much weight on the disc and you are putting more pressure on the disc if your body weight is too high. Smoking is also seen to increase the degeneration. So if all those smokers, I would request to start quitting that smoking, because you need your back to be better. It's bad for your back also, and we need to understand that. But the biggest problem nowadays is because we are our bread earners. When we are going to earn our bread, and most of us sit for long, arduous hours doing our desk job and working day in and day out. And that's the time we need to understand that this itself can cause degeneration. The problem with this is we can't avoid it. We need to work, we need to do our job. But there are ways to mitigate the effects of it. If you can change the way you are sitting, if you can change the way you are doing your daily activities, it will help you a lot and prevent your disc degeneration, and subsequently prevent your problems later on. Treatment, the most important thing in this to prevent disc degeneration is self-care. How you are sitting, how you are doing, if you are involved in a desk job, if you are bending forward, sitting in the same place for more than half an hour, if you're not moving around too much, the rule of thumb is half an hour at a single place, not more than that. If you can move around after half an hour, that will help the back a lot. Physical exercises, there are the problem with exercises is we don't understand that exercises for back are different. There are certain kind of exercises which help each group of muscles. We need to understand that, and we need to do those for our back. Most of us go to the gym and pull weight and do all those things, but that's not the way we can strengthen your back. The way of strengthening your back, and most of the times, take it from me, they harm your back more than helping your back, because we are not trained to do it, we don't do it properly, and if you don't do it properly, it's going to harm you a lot. I am not against the gym enthusiasts, but anything has to be under limits and anything has to be scientifically based, then only it's going to give you advantages. If you talk about physical therapy, exercises, heat or cold, whatever helps you can be done. There are certain centers like us, we do injections for the back pain, we do injections for relieving the pain of the nerves, we do injections for relieving the pain of the muscles, and then it can help you a lot. But the bottom line is still you need to change the biomechanics of your spine, only then you will get back to your normal things. And of course, if you don't improve with all those conservative treatments, you need to go and have an operation if need be. So if you understand about the spine and understand the way the spine works, you will understand that most of the spine fractures don't need any operation. So if you talk about the spine, if this is your spine, we divide the spine into three parts. So if I draw a line here, this is the front part. If I draw a line here, this is the middle part, and then you have the back part. So if you see, this is the front part, this is the middle part, this is the back part. And this is the concept where we work on. We see the concept of Dennis, this was originally given by Dennis, and he talks about the stability of the spine. So any fractures needs to be fixed or operated only when the spine stability is gone, is not there. Your spine is not able to support you, and it is causing damage to the nerve roots. Any spine fracture can be severe enough to warranty an operation, or most of the times it's mild. It could either be a ligament injury, it could be a muscle sprain which gets relieved on its own, or with muscle relaxants and painkillers. Now fractures can be either a fracture of this bone per se or a dislocation of the spine. So if you see, if my spine is here in a line, and if it is coming like this is a dislocation. And if you have a fracture of this bone, this will be called as a fracture. So this is the vertebra and this is the disc in between. So if you have a fracture of this bone. So if you see, these are all solid bones. So unlike other bones of the femur, the thigh bone, the hand bones, it does not separate. It just gets compressed like a swash. If you press on a dough, it will swash itself. It won't separate out. So that's what happens in the spine. The most important thing in spine is it protects the spine, the nerve roots and the spinal cord, and it gives the stability to your back. If any of these two things are countermanded, then you need an operation or some kind of help to help the fractures heal. The causes are most commonly it's because of the accidents. It could be because of a fall from height. It could be because of a sports injury or any quarrel or violence. Now, it is important to understand the mechanism of injury is very important when we understand a fracture. If you have a significant fall and you have a significant injury, then chances are that the fractures will also be significant. But if there is a fracture without any significant trauma, then you need to be more worried, because then the reason is the bones are very weak, either because of osteoporosis or because of any pathology like infection, tumors, or cancers. So then you need to be worried more than a fracture which has happened because of a significant trauma. And most of the times, 80% of the times, it's the young people who have a spine fracture. And if you understand that young people have all their life to deal with. So over a period of time, if you don't have the proper alignment of the spine, it will lead to what is called as compression of the spinal cord. And this will lead to weakness or radicular symptoms or permanent damage to the spinal cord. So that's the reason you have to understand that understanding fractures of the spine is important. Now, if you talk about diagnosis, it's most of the times either an X-ray, CT, or an MRI which will give you a conclusive diagnosis. Clinically, you can feel that pain in the spine, you can press on the spine and feel the tenderness, but it's mainly the X-rays and the MRI. So you need to visit a doctor if you have severe pain or significant persistent pain in the back after an injury. What can be done for it? Most of the times you don't need any kind of treatment, because most of them are either ligamentous injuries or muscle spasm. Sometimes you may need a brace which will helps the spine to maintain its alignment. It will immobilize the spine and prevent the pain, and importantly, pain control in a long term, because you can't give pain medications for a prolonged period of time. If you talk about the treatment of fractures, most of the times it's braces or muscle relaxants and painkillers, and most of them don't need surgery because the stable spine is stable enough to bear the weight of your body, and it's not causing compression on the spinal cord or the nerve roots. Braces work in three mechanisms. It will help the spine to maintain its alignment, it will immobilize the spine, and it will give pain relief. Those are the main reasons we use braces, and most of the times we end up having braces for good 3 to 4 months compromised, or there is compression on the nerve roots which is causing damage to the uh, which is causing weakness in the legs. Then you end up having an operation to maintain the alignment and decompress the nerve roots which is getting crushed. So most of the times it involves putting screws into the vertebral body and rods to stabilize it, and then decompressing the compression which is there. And most of them, if there is no weakness, do well. The problem is if there is permanent damage to the spinal cord, then most of them don't improve. There are chances of improvement, but the chances are negligible. So we need to understand that we need to protect ourselves when we are driving, and we need to protect ourselves when we are working at a height or doing something at a height, or we are involved in some kind of altercation when we have to take care of our back also. Hope you have gained out of the talks, and for more such videos, like, share and subscribe to our channel.